Afternoon et bon après-midi à tous. Thank you for joining us for today's special media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery. That button is located on the top right corner of your Zoom video screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we have many speakers who will be making remarks, starting with Mayor Jim Watson, Dr. Vera Etches, Chief Medical Officer of Health, Claude Brûlé, President Algonquin College, Dr. Benoît-Antoine Bacon, Président Carleton University, Lise Bourgeois, Présidente La Cité, Jacques Frémont, President of the University of Ottawa, Peter Slowly, Chief of Ottawa Police Services, and Anthony DeMonte, General Manager of Emergency and Protective Services. Nos porte-paroles aujourd'hui seront le monsieur maire Jim Watson, Dr. Vera Etches, la médecin en chef santé publique, Claude Brûlé, président du Collège Algonquin, Dr. Benoît-Antoine Bacon, président de l'Université Carleton, Lise Bourgeois, présidente de la Cité, Jacques Frémont, président de l'Université d'Ottawa, Peter Slowly, chef du police de service d'Ottawa, Anthony DeMonte, directeur général des services de protection et d'urgence pour la ville d'Ottawa. Je passe maintenant la parole au maire d'Ottawa. Please go ahead, Mayor Watson.
Great. Thank you very much. Bon après-midi, mesdames et messieurs. Good afternoon, ladies and gentlemen. And thank you for joining us for today's media availability. In particular, I'd like to thank the presidents of our 4 post-secondary institutions, L'Université d'Ottawa, Carleton University, La Cité, and Algonquin College for joining us. And you'll hear from those 4 presidents in just a moment. I'd also like to thank the presidents of the student unions of the 4 post-secondary schools who are also with us today. Thank you to Kathleen Weary, president of CUSA at Carleton, Emily Ferguson, president of the Algonquin Students Association, Nina Nemdombe, Association étudiante Cité collégiale, and Babacar Faye, University of Ottawa Students Union. We've all heard in recent weeks that people under the age of 30 represent the largest group contracting COVID-19. Of the nearly 3,000 confirmed cases of COVID-19 in Ottawa, those 30 and under make up close to 900 of those cases. This group includes many college and university students. For the past several weeks, OPH has been working closely with post-secondary institutions to ensure the preparedness on campus for the fall semester. This is typically a celebratory time for students making new friends and seeing old ones. However, when students do get together, we're all asking you to practice being social wise. Il s'agit d'une période de l'année habituellement festive pour les étudiants qui se font de nouveaux amis et retrouvent leurs anciens camarades. Toutefois, lorsque les étudiants se rassemblent, nous leur demandons de ne pas oublier d'être social avisés. This means that you can be social, but you must limit your close contacts and adhere to COVID-wise principles. This means respecting gathering limits for indoor and outdoor gatherings. It means maintaining a physical distance of 2 meters and wearing a mask when this is a challenge, even outdoors. It means getting used to having a mask on your person at all times in the event you cannot physically distance with those outside your social circle. It means staying home when you're not feeling well, and it means continuing to be vigilant about washing your hands and not touching your nose, eyes, and mouth with unwashed hands. You can visit ottawapublichealth.ca. It's a great website for tips to party safer while being COVID-wise. As we've heard from Dr. Etches before, and you'll hear from her in a few moments, few, if any, cases of transmission are occurring in those areas of the city where masks are mandatory. This is why it's so important that we continue to follow the rules set out in the city's temporary mandatory mask bylaw. When we wear closed masks, we are helping to protect not only ourselves, but everyone around us. COVID-19 is still very much in our community, so it's imperative we keep community transmission numbers as low as possible while we continue to resume as many of our normal activities as possible. Nous avons été témoins d'autres communautés ailleurs dans le monde qui ont relâché leur vigilance et nous avons vu qu'il ne fait pas que pour que le virus se propage de nouveau très rapidement. We've seen communities in other jurisdictions get careless, and we've seen that it doesn't take very much for the virus to spread very, very quickly. In the US, for example, the University of Alabama saw a surge of 531 cases at the start of their school year. Most of these cases can be traced back to students attending large back-to-school parties off campus. There are countless other examples across the US of similar surges taking place after students return to universities and colleges. We can't afford to have the same trend in Ottawa. By law, and Ottawa Police Service will be out issuing tickets for anyone that breaks the provincial order prohibiting large gatherings. If you don't cooperate, you'll have to pay a fine of $880. That is a very expensive fine for hosting a party that's gotten out of control with far too many people. How this year unfolds is ultimately in the hands of the students that come to the 4 post-secondary institutions here in Ottawa. If you want to see your university college experience return to normal, it is imperative that you be COVID and social wise. There's a wealth of information available at ottawapublichealth.ca, and every post-secondary institution has its own COVID-19 protocols in place that need to be respected. This is a serious issue, there's no question about it. And all of us went to college and universities, and we had a great time during Frost Week and orientation, and we enjoyed meeting new friends and new people, both on campus and off campus. But this is a very different and difficult year for everyone, and I encourage all students in Ottawa to please be respectful of one another, not to hold these mass parties off campus at your home, and understand there are not only financial consequences, but health consequences for you and your friends. Thank you. Merci beaucoup.
Thank you, Mayor Watson. Je passe maintenant la parole au médecin-chef en santé publique. Please go ahead, Dr. Etches.
Hello, everyone. Bonjour, Quay. La COVID-19 nécessite des changements importants dans la façon dont nous vivons nos vies et l'expérience post-secondaire ne fait pas exception. So earlier today, I've written a letter to college and university students, and it's for people returning to campus or coming back or who are here for the first time. And the letter is going to reinforce the importance of being COVID-wise, of highlighting public health resources that exist to support you, and what's required here in Ottawa that's different under our city's temporary mask bylaw. So there are limits on social gatherings, and there are specific requirements for international students as well. And for the past several months, we've been working closely with the colleges and universities. We've been making sure that they're ready to welcome you back onto campus for the fall semester or welcome you for the first time. We've been really focusing, there's been a lot in the news about school preparation, but on the same kinds of things with universities and colleges, making sure there are practices to increase distance, to use masks, to make sure that we're doing things in a way that increases the level of protection against transmission of COVID. We've developed resources for students, you'll see, and for the employees on campus. We've reviewed the plans for international students, and we've got protocols in place for if there were to be outbreaks identified and how we'll communicate. We are engaged as well on the environments in residences and looking at making sure everything's as safe as it can be for visitors and employees as well. Je tiens à rassurer les étudiants et les établissements postsecondaires que SPO Santé publique Ottawa est là avec vous à chaque étape de votre parcours éducatif. And I imagine students will be on their computers more than ever. So while you're doing your research or you're writing your papers, be sure to bookmark our website. The mayor mentioned ottawapublichealth.ca www.untitled.ca/coronavirus. You can find a lot of information on COVID-19. It will include information about how to access testing, which many young people are doing, how to be COVID-wise, the number of cases, what's happening, the picture in Ottawa, and what to do if you do test positive for COVID-19. There's a lot more there I encourage you to explore. And apart from COVID-19, to also support you in a fun, happy, safe start to the school, we have other resources about mental health, sexual health, nutrition, and accessing health services. So visit our website frequently, follow us on social media, check out our youth portal. This is messaging that's designed directly for young people in our community. It's at the link ottawa.ca. And I also want to share some information that everyone might be interested in knowing about the COVID Alert app. So this is an app that you might have been notified by on your phone that you can download. We actually just learned of our first individual who was notified through the COVID Alert app that he'd been in contact or close contact with someone who has then gone on to test positive for COVID-19. And that person then went for testing and also tested positive for COVID-19. So this is useful. The more people download the COVID-19 app, the better. It will help us, the larger percentage of the population that uses the app. So I want to acknowledge that a new school year, being in a new place for some can invite anxiety. And that's at the best of times. There's a lot of anxiety right now in our community. And so we want you to know as students that it's okay not to feel okay and that there are supports for you. So please, again, there's mental health resources on our website and you can reach out. There are people to talk to. Santé publique Ottawa est si fière des habitants d'Ottawa et de faire partie d'une communauté aussi engageante et solidaire. Many people are working hard to keep COVID manageable in our community, and I want to thank you for doing your part. Nous sommes tous unis contre la COVID-19. So welcome back, or welcome, and thank you.
Thank you, Dr. Etches. Je passe maintenant la parole au président du Collège Algonquin. Please go ahead, Mr. Brûlé, President of Algonquin College.
Thank you, Catherine. It's a pleasure to be here today with Mayor Watson, Dr. Etches, and my fellow post-secondary presidents and student president leaders to discuss this unprecedented fall term and the important part we must all play in keeping each other safe. I know that a big part of the normal campus experience is people, meeting old friends, discovering new friends, peers, mentors, but COVID-19 has changed the way we live our lives, and this year we must exercise caution in all of our interactions. We must make the health and safety of our college community and the greater Ottawa community our #1 priority. That's why Algonquin College's plan for the fall term minimizes face-to-face instruction and promotes remote learning wherever possible. Access to our campuses will be limited to only those employees and learners who will be starting or continuing their academic journey and are required to be on site. About 10% of our total student population will be on campus on any given day, with our learning environment and our hands-on curriculum adapted to minimize risk. We learned a lot this summer during our successful summer pilot program, which saw over 600 students return to campus for learning activities during July and August. That experience has helped us build a plan for the fall term that considers every detail. Some aspects of this plan include students attending campus must complete a mandatory online health and safety training. We created a return to campus site and a campus access guide for students, which includes policies and health and safety guidance. It answers questions students might have on everything from how to safely use the elevators to the proper etiquette for coughing and sneezing. The majority of our campus services, student supports, and resources are available virtually, and all in-person events on campus have been suspended until the end of December. We're confident in the safety-first approach that all of our departments are taking, from facilities management and security services to student services and our academic teams. But personal choices remain the key to ensuring everyone's safety. The choices we make at home, in the city, and on our campuses remain critical. We are a community, and we're all in this together. So my message to all students and employees is, please follow public health guidelines. Wash your hands thoroughly, don't touch your face. Make sure you practice physical distancing and wear a mask. We must continue to be vigilant. COVID-19 is present in the Ottawa region, and cases among the 20 to 29-year-old age group have been on the rise. We must do all we can to protect ourselves and those around us. We know that this fall term will be filled with new experiences and new challenges, but I believe that with challenges also come opportunities for innovation and resilience. These times of adversity show us how vital community is to our collective well-being. We need to support one another to keep our institutions, our city, and our people safe. Thank you. Merci. Miigwech.
Thank you, Monsieur Brûlé. Je passe maintenant la parole au président de l'Université Carleton. Please go ahead, Dr. Bacon, President of Carleton University.
Merci beaucoup, Catherine. Bonjour, tout le monde. It's a real pleasure to be here today with my academic colleagues, with our student leaders, and of course, with our community leaders. And Mayor Watson, let me start by saying that we really appreciate your leadership throughout these unprecedented times. Dr. Etches, thank you so much for keeping us safe and informed throughout this. We're really grateful that we were able to work with you and Ottawa Public Health to ensure that our plans at Carleton will continue to keep everyone as safe and healthy as possible. Thank you. Chief Slowly and General Manager DeMonte, thank you both for your remarkable service to our community. I'd like to thank and recognize our students, staff, and faculty, those at Carleton and those at the other institutions. They've kept going with courage and compassion throughout the crisis. And they've also found a way to contribute in multiple ways by doing important research on COVID-19, by working with public health, by working with service agencies and businesses, and by contributing to the well-being of our community. It's a real honor and privilege to be part of this community at this difficult time in our history. September is a difficult time for those of us who've given our lives to education. The fall term that's coming is not the one that we would have imagined months ago. As I wrote to the Carleton community yesterday, it will be strange not to welcome 35,000 people to our campus come September 9th, but we'll be making sure that our students feel welcome. We'll be making sure that our online courses, our programs are vibrant and stimulating, that our services, very much including mental health services, are all delivered as they usually are. We're doing everything in our power to ensure that this fall term is a great success. And of course, we're making everything in our power to make sure that it is safe for everyone. At any given time during the fall term, given that our courses are online, there will never be more than 2,000 people on the Carleton campus. These include researchers, graduate students in labs, essential service staff, and about 1,200 students in residences, which is about 25 to 30% capacity. We've devised a truly extensive plan to ensure that all recommended safety protocols are followed. And if you'll allow me, I'd like to give a shout out to the people on the front line who've been putting these measures and safeguards in place. This week, we'll be communicating very intensively the details of our plan to all members of the Carleton community, new and returning. The health and safety of our community is absolutely our very top priority. We've said this since the very beginning, and we've taken steps to protect everyone that needs to be on campus at any time. Over the coming months, we anticipate a further gradual return to campus, but we're not quite there yet. There's lots of change on campus. We've adapted how people move through buildings, where they can sit. There's signage everywhere to safely guide people. And of course, we've reduced occupancy limits in all buildings. For example, our McCodrum library, who can usually sit thousands of people, welcomes about 50 at the present time. Protocols for all our public spaces provide for very frequent cleaning. Building ventilation has been optimized. We're making hand sanitizer, disinfectants, and personal care kits, including masks, available to everyone. We're constantly updating our website and our information, communicating with our community to ensure that we're all safe. In this way, we can pursue our academic mission, we can continue our operations, but safely. We're fulfilling our core mandate in innovative ways. We're connecting with our partners through new means, and will be with our community and with the Ottawa community every step of the way. Our researchers continue to contribute to solutions to some of the most pressing COVID-related problems. The pandemic is affecting every aspect of our lives, and it demands a response that is bigger than any one discipline. We launched a rapid response grant program earlier this year to encourage new approach, and we've been funding everything from diagnostic to national security concerns, reusable face masks, and balancing work and family demands. Some of our new programs are also very much the product of the challenge of COVID. I'm thinking of my home department, psychology, who's just now launched a new mental health and well-being stream for the department. We've also devised new ways for students to experience digital training and work placements. So in these very challenging times, let me finish by saying that we're following at Carleton our ethos of resilience, of compassion, of flexibility, and we're very much seeking in every way to serve our city and to serve our world. Merci beaucoup. Thank you very much.
Thank you, Dr. Bacon. Next, we will be hearing from the President of La Cité. À vous la parole, Madame Bourgeois, Présidente de La Cité. Madame Bourgeois, vous êtes encore en sourdine. Voilà.
Ça va mieux maintenant?
Oui, c'est parfait.
Alors, je voudrais d'abord vous dire bonjour et commencer en remerciant Monsieur le maire Watson et Dr. Etches de nous fournir cette occasion de partager ensemble ce moment pour se rappeler que le monde a changé, nos institutions aussi. Et je voudrais saluer les étudiantes et l'étudiant de la Cité, Nina et Xavier, qui sont avec nous aujourd'hui, et que ça nous donne l'occasion de se voir, du moins à l'écran, si on ne peut pas se voir en personne. Donc, je dis, le monde a changé, la Cité aussi. Et ce qui a changé vraiment, c'est notre environnement et c'est ce que nos interactions, ce que nous faisons ensemble. Alors, bien sûr, comme mes collègues l'ont dit avant moi, nous avons fait toutes les adaptations possibles et parfois impossibles dans nos institutions, dans nos environnements pour accueillir les étudiantes et les étudiants à la rentrée. Et je peux vous assurer que nous sommes prêts pour accueillir en toute sécurité nos étudiants et notre personnel pour la rentrée 2020. Alors, on a mis en place, bien sûr, de nombreuses mesures sanitaires dans le respect des consignes de santé publique. Et merci, Dr. Etches, pour nous avoir fourni l'occasion de vous parler régulièrement et d'avoir une rencontre avec vous pour s'assurer qu'on avait toutes les bonnes mesures en place et votre diligence de répondre rapidement à nos questions. Je peux vous dire aussi que les équipes de la Cité ont travaillé d'arrache-pied très fort et continuent de travailler pour que la rentrée, pour que l'année scolaire 2020-2021 soit des plus pertinentes et des plus apprenantes pour les étudiants. Alors, elles ont travaillé à offrir un apprentissage. On sait que ce sera un apprentissage majoritairement en grande partie à distance, mais j'aime bien dire qu'avec ce qu'on a appris à faire ensemble, on sera quand même ensemble à distance et ce sera des apprentissages de qualité, pertinents et de qualité. Le projet pilote nous a grandement aidés. Ce que nous avons fait à l'été, le projet pilote que les institutions ont pu faire à l'été, nous ont permis de raffiner nos mesures et les moyens qu'on se donnait, les mécanismes, les protocoles pour être tout à fait confiants que nous avons en place ce qu'il faut pour assurer la sécurité et la santé de nos étudiants qui est, comme mes collègues l'ont si bien dit, c'est une priorité pour nous, pour nos étudiants et notre personnel. Ce que le projet d'été nous a permis de faire aussi, c'est de compléter ou de faire en sorte que la grande majorité de nos étudiants ont pu compléter leur année scolaire, ce qui nous donne, ce qui nous rend confiants aussi que nous pourrons compléter la prochaine année scolaire aussi avec nos étudiants. Bien sûr, tous les étudiants ne seront pas au collège en même temps. Seuls les étudiants qui auront des laboratoires ou des ateliers spécialisés seront au collège. Et on parle d'une 50aine d'étudiants par édifice à la fois, ce qui nous permettra de recevoir les groupes d'étudiants en séquence de façon structurée avec le professeur et les quelques employés qui seront en appui à notre personnel. Donc, on parlait tantôt d'environ 10% de l'ensemble de nos étudiants qui seront en même temps au collège et qui seront, à qui on rappellera quotidiennement toutes les mesures à prendre pour que ce soit le port du masque, le lavage des mains. On désinfecte de façon accrue. On a ajouté aussi, la ventilation est accrue, alors tout est prêt et tout sera là pour les étudiants. Je voudrais aussi, encore, comme les collègues ont bien dit, les services disponibles aux étudiants vont continuer. Alors, tous les services continuent d'être accessibles et disponibles pour nos étudiants, que ce soit les bureaux d'admission, l'aide financière, le service de placement. Les services d'appui à la réussite continueront d'être disponibles, accessibles pour nos étudiants, bien sûr, à distance. Nous avons aussi développé à la Cité une application qui va nous permettre, alors chaque étudiant recevra une application. D'ailleurs, dans les prochains jours, les étudiants vont recevoir un guide très détaillé avec même une liste de vérification, une checklist, qu'ils pourront cocher avec des liens lorsqu'on veut en savoir plus, qui va faciliter le cheminement et l'intégration à la Cité dans le contexte de la COVID. Alors, on a cette application qui sera, chaque étudiant et chaque membre du personnel aura cette application qui va faciliter les accès puis réduire les risques, assurer un meilleur suivi. Ça va être aussi lié à l'horaire. Donc, nous, ça nous permet de faire les suivis et au besoin de communiquer avec Santé publique ou que la personne puisse aussi elle-même communiquer avec Santé publique. Merci de nous avoir rappelé que vous avez toutes sortes d'informations et d'outils disponibles sur le site de Santé publique. À la Cité, on a toute une équipe qui assure la communication sous diverses formes auprès des étudiants. Puis ça veut dire autant le bureau du registraire, les professeurs qui communiquent individuellement aux besoins avec les étudiants. Et tout le personnel est habilité à répondre aux questions ou pourra répondre aux questions des étudiants qui veulent s'inscrire à la Cité ou qui sont en voie de s'inscrire ou qui sont déjà inscrits à la Cité. Alors, voici tous les outils que nous avons mis à la disposition de nos étudiants pour s'assurer, de notre personnel, bien sûr. C'est accessible aussi si les gens vont sur le site web, les questions-réponses pour parfois les parents qui peuvent aussi s'inquiéter. Donc, toute l'information, on n'a ménagé aucune information, aucun moyen, que ce soit sur Facebook, les médias sociaux, des notes. Alors, tous les moyens ont été mis en œuvre pour assurer une communication fréquente et régulière avec les étudiants et le personnel. Le monde a changé, la Cité aussi, mais je répète notre hashtag La Cité ensemble parce que nous croyons vraiment que c'est la Cité ensemble et ensemble avec nos partenaires, dont Santé publique, que nous allons naviguer à travers cette crise. Je dis toujours par vents et marées. Nous allons traverser la crise, mais ça prend la collaboration des jeunes, comme vous l'avez mentionné, des moins jeunes, de chacun de nous, individuellement et collectivement, pour forger ensemble l'avenir qui nous attend, l'avenir qui est à notre porte et que nous pouvons adapter, s'adapter pour faire le possible et l'impossible pour bien servir nos étudiants et ainsi notre communauté. Merci aux étudiants qui sont avec nous aujourd'hui et j'espère que ce qu'on vient de se dire sera disponible pour nos étudiants parce qu'il y a tellement des beaux messages qui se disent aujourd'hui et non seulement par nous, présidents de notre institution, mais par les autres aussi. Alors, on chante ensemble la même chanson. Merci. Merci, thank you.
Merci, Madame Bourgeois. Je passe maintenant la parole au président de l'Université d'Ottawa. Please go ahead, Monsieur Frémont, President of the University of Ottawa.
Merci beaucoup, Catherine. Bonjour à tout le monde. Merci au maire Watson, merci au Dr. Etches pour leur excellent travail, pour leur leadership remarquable dans cette crise. Nous sommes vraiment privilégiés d'avoir des gens de votre calibre dans la région et je m'en réjouis. J'en profite pour saluer le président du syndicat des étudiants à l'Université d'Ottawa, Babacar. Good to see you. C'est un plaisir de te revoir. Et je voudrais remercier mes 3 collègues des universités et collèges de la région qui ne m'ont rien laissé à dire, puisque vous avez tout dit. Et ce que vous avez dit, nous faisons la même chose. So I just want to thank them for their generosity. So they've left nothing else to say, but to insist that the health and security of our students and our staff members are of the utmost importance and will be a priority throughout the year. Like everybody else, we follow all the public health measures, and we're very similar. All the measures are taken in our universities, and Benoît-Antoine Bacon has described we're taking exactly the same measures. One thing, we do insist that students behave responsibly on campus, but also outside of campus. So they're a member of the community 24 hours a day, and it will be very important that their behavior is exemplary, not only on campus. 2 distinguished features maybe for the University of Ottawa. Tout d'abord, nous avons mis sur pied un centre de test pour le COVID-19. Donc, il sera possible pour nos étudiants et pour les membres de nos personnels de se faire tester sur place. Ça va commencer d'ici une semaine. C'est en collaboration avec l'hôpital d'Ottawa. So this testing facilities, to our knowledge, on a university campus is unique in Ontario so far. I do hope that others will be able to join. This is very important, and I think it will be very reassuring for our students, for their parents, and for the members of the community. We've also hired 125 student ambassadors, donc des ambassadeurs étudiants qui sont en voie d'être formés et dont le rôle va être de se promener sur le campus pour faire respecter les règles de distanciation physique de façon aussi douce que possible, mais de façon aussi insistante que possible. Donc, ces 125 personnes vont patrouiller le campus à partir du début de la semaine prochaine. And I think that it will be important to remind members of our community on campus that they have to wear a mask and they have to keep the social distances. So these are two of the initiatives we're putting forward. Tout comme mes collègues, we've learned a lot last summer. Last summer, we had more than 700 students in residences. They were living on campus and eating on campus. And we've had 2/3 of our researchers working on campus, and there's been no incidents and no outbreaks. So we'd really dearly love to keep it that way. But we've learned a lot about how we can work so that constructively with the community. Cet automne, 95% des cours à l'Université d'Ottawa vont être à distance. Il va y avoir néanmoins 135 cours sur le campus. There will be more or less 3,000 students on campus, but of course spread out in the 5 days of the week. And we'll have around 1,000 students in residence. So again, we will encourage students to behave responsibly, both within and outside of campus. Often, and I don't know if it's the same for you, Benoit, but people ask me, what keeps you awake at night these days? And I must say that pretty everything keeps me awake these days. But this being said, there's one issue which is really on top of my mind, and it was referred to by Dr. Etches, and it's the issue of mental health. And it is a crucial issue, and not over and above, but in parallel with COVID-19. Getting back to school, getting into university is already a special moment in the life of any young person, and it can bring a lot of anxiety and stress. Et la priorité dans ce contexte-là, dans le contexte actuel, où avec le COVID-19, les niveaux de stress et d'anxiété sont encore plus élevés que d'habitude, il va être absolument important de porter une attention très particulière et très soutenue à la question de la santé mentale sur notre campus. Every student being isolated will be followed on a daily basis. They will get calls. We will keep in touch with them. Et nous avons cette année, comme toujours, une équipe de plus de 20 conseillers en santé mentale qui sont disponibles. On peut les rencontrer la journée même. Pour l'essentiel, ça va être des rencontres virtuelles. But we will have more than 20 conseillers, counselors in mental health who will be available day after day after day. And there will be some other measures regarding the support of our staff and students in mental health. And we care deeply about our students, and we want to remind them all that they will never be alone, that help will always be available for COVID-19 and for their mental health on our campus. As Lisa and others have said, this will be a challenging year, but I'm confident that we can make it a rewarding one as long as we continue to work together and to support one another. And I just want to end by saying that if you are looking for masks, we have some really nice GG's masks on the campus. Merci beaucoup. Thank you very much.
Thank you, Mr. Fremont. Je passe maintenant la parole au chef de service de police. Please go ahead, Police Chief Peter Slowly. And you are still muted.
Merci beaucoup. Bon après-midi à tous. The Ottawa Police Service continues to support the overall efforts by Ottawa Public Health and our partners to reduce the spread and harm of COVID-19 in our community. I want to thank Dr. Etches and the Ottawa Public Health team for their continued leadership on this issue. As part of our regular work in the community, we visit local restaurants and bars to ensure COVID-safe protocols are being followed. We've received a great deal of cooperation from those establishments and the people who visit them. And we work in a coordinated manner with our Ottawa bylaw partners. As we do so every school year, our officers are in neighborhoods across the city and have been working with community associations, colleges, and universities to welcome our students back. In partnership with the city bylaw, as well as our campus safety partners, there will be an increased presence around campuses to ensure a safe and healthy return to school for students and the residents in and around those campuses. Let me echo and reinforce Mayor Watson's message. The Ottawa Police Service takes this public health and public safety issue very, very seriously. It affects everyone, our police service members, our families, our youth and students, and all of our neighbors in all of our communities. It is especially dangerous to our most vulnerable, marginalized, and often most racialized communities. Our neighborhood resource teams, community resource officers, frontline patrol officers, and undercover plainclothes officers will be out proactively monitoring areas in support of Ottawa Public Health-led guidelines, as well as the provincial legislation to help make our city and our communities safer for all of our residents and our returning students. We know many new and returning students at post-secondary institutions have opted for online learning this year. And as a result, the student population is noticeably reduced. That said, we are urging those who are returning to follow all the public health guidelines and to be COVID-wise. This includes events on campus and off campus, house parties and private parties. Police and Ottawa bylaw can issue fines up to $1,000. And we will do so if we discover large, unsafe, and unhealthy parties. Ontario Stage 3 implementation limits indoor gatherings to no more than 50 and outdoor gatherings to no more than 100, while maintaining physical distancing and wearing a mask as mandated by the province. To be clear, we will continue with our joint education, engagement, and enforcement campaign, focusing most on education and engagement. We will continue this throughout the return to school to remind residents and students to be respectful of neighbors and to help us, all of us, to keep everyone safe and healthy during this pandemic. Merci beaucoup. Thank you.
Thank you, Chief Slowly. Je passe finalement la parole au directeur général des services de protection et d'urgence pour la Ville d'Ottawa. Please go ahead, Mr. DeMonte, General Manager of Emergency and Protective Services.
Merci, Catherine. Like my colleagues have mentioned, city staff are working diligently to ensure a safe return to school this fall. This includes our university and college students, who contribute so much to our social and economic life in our community. Le personnel s'emploie à assurer une rentrée des classes sécuritaires cet automne, y compris pour les étudiants et les étudiantes des collèges et des universités, lesquels contribuent énormément à la vie sociale et économique de notre collectivité. We know the pandemic will impact the student experience this year, with many classes moving online, and other milestone events like Frost Week being significantly modified to protect health and safety. We know these are difficult realities, especially for those embarking on a new chapter in their lives, and we understand this, and Ottawa wants to remain an attractive and engaging destination for students. At the same time, we need to ensure our community remains on a good trajectory with respect to the pandemic, especially as we head into new territory this fall. That is why bylaw enforcement staff are coordinating with city partners, including Ottawa Public Health and Ottawa Police Service, and have engaged with colleges and universities, student associations, and other groups to ensure a safe and COVID-wise return to school. Nous devons nous assurer que notre collectivité reste sur la bonne voie face à la pandémie, et ce, d'autant que nous entrons dans une nouvelle réalité cet automne. C'est pour cette raison que le personnel chargé d'application des règlements municipaux collabore avec les partenaires de la Ville, dont la Santé publique Ottawa et le service police d'Ottawa, et a mobilisé les collèges et les universités, les associations d'étudiants et d'autres groupes pour faire en sorte que la rentrée scolaire se déroule de manière sécuritaire. It is essential that every student in college and university abide by the public health recommendations on campus and around the city. Wear a mask, limit physical gatherings, and ensure public distancing, among other things. These are well-known strategies at this point, and we expect most students in college and university have already implemented these behaviors in their daily lives from the onset of this pandemic. Bylaw enforcement staff will nevertheless be out in the community monitoring for compliance with the provisions of the temporary mask mandatory bylaw, with a focus on educating the public and those who have newly arrived in Ottawa for school. Tous les étudiants et étudiantes des collèges et des universités doivent absolument se conformer aux recommandations en matière de santé publique sur le campus et dans toute la ville. Le personnel chargé de l'application des règlements sera dans la communauté pour vérifier que les dispositions du règlement provisoire sur le port obligatoire du masque soient respectées, tout en s'attachant plutôt à la sensibilisation du public. The city welcomes new and returning college and university students to our community, and we remind everyone to continue to play a role in our collective resolve to respond to this pandemic this fall. Merci beaucoup. Thank you.
Thank you, Mr. DeMonte. In the interest of time, I will read through the list of media who have registered for today's avail. No need to indicate if you are present. However, if I have missed your outlet, please speak up after I'm through the list. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas mentionné votre agence. 1310 News, CBC National News, CBC Local News, CTV News Ottawa, Global News, Le Droit, Ottawa Citizen, Radio-Canada, the Canadian Press, TVA Gatineau Ottawa, and your community voice. Have I missed an agency? Est-ce que j'ai manqué quelqu'un? I will now invite each agency in alphabetical order to ask their question. Please remember you have one question and one follow-up only. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We'll start right now with 1310 News. Please go ahead. (1310 News). We'll move on next to CBC National News. The floor is yours.
Hi, this is a question for Chief Slowly. Chief Slowly, there have been concerns raised recently about a video taken during a traffic stop by a black man in Ottawa who was wrongly accused of having an expired license plate tag by a member of your service. There have been countless stories and videos of black people being stopped by police for minor infractions that end up resulting in bodily harm or even death. There are growing cries from communities around this country that there is simply no more trust in police officers to protect Black or Indigenous lives. What kind of actions do you think the police should and can take to build back trust and improve relations and interactions with racialized members of the community?
Thank you for your question. If you'll contact our corporate communications folks, be happy to set up a different media interview for that topic. I think this is an important topic to focus on COVID-19 and the public health crisis and pandemic that we're facing here. I'll defer to the moderator to see if you'd like to move on to another question.
Yes, the topic of today is focused on COVID-19 in post-secondary institutions. However, if there's another question for following up specifically on that, we can take it.
Respectfully, we did reach out for your conversation with with Chief Slowly, and we did not receive a response. So I would appreciate an answer to the question.
Thank you. We will move on next to CBC Local.
Hi there. I'm not sure who wants to take this question, but it is around the enforcement issue of parties. I understand that you will be out in higher forces, but you know, we've heard in other cities about parties going underground, planned underground parties. What kind of what kind of extra enforcement can you do around that area, or are you just, counting on people kind of tattletaling, for lack of a better term?
Well, perhaps I can start, and if the chief wants to add, it's a collaborative effort we're doing with Ottawa Police, Ottawa Bylaw. I don't call it tattletaling. I think we all have a responsibility, first and foremost, to, as we've heeded Dr. Etches' advice, not to put ourselves in the situation. In today's press conference from all the leaders of the colleges and universities and the associations are telling their members, their students, please don't do those type of things. We saw what happens, as the mayor indicated, in other American cities, and so we don't want that taking place. I think that's first and foremost. Secondly, I think we have an individual responsibility societally. We're doing extremely well. Dr. Etches has led us through this pandemic with her leadership and with some simple things, and she's mentioned that this community is doing well. We want to continue that. So yes, directly to your question, if we're advised of underground parties, etc., we will intervene, and we have the tools to intervene. We've been, since the beginning, both us and Ottawa Police, focused on education and trying to elicit in people an understanding that this is an individual responsibility, that we help all of the community when we behave appropriately. And when we don't, we have the tools, and we will not hesitate to enforce, and we will be out in more significant numbers, especially as we're getting back to fall in the schools. And I'll turn it over if Chief Solly wants to add anything.
Thank you, Tony. The only thing I'll add, agree with everything what Tony said. We've had a number of large gatherings over the period of time since COVID was declared a pandemic. And I will say one of the reasons why Canada is one of the safest countries in the world, and the nation's capital reflects that, is that the vast majority of the people who live and work and visit here come here for the right reasons, to do the right things and to contribute to health and safety, the economy. We anticipate very minimal challenges. We have a very engaged community who will notify us of any public safety issues, and will bring the best approach possible. The best approach is always education and engagement. I think in some 1% to 3% of the times where we've had to go to gatherings that are illegal and unhealthy, people have listened to that education, they've responded positively to the engagement, and they've complied and created a healthy and safe environment for folks. And only in the very rare occasions have we had to resort to enforcement. It is a tool in the toolkit, but not one that we want to pull out first or most. And we'll rely on the cooperation and the goodwill of people to keep each other healthy and safe.
Okay. And just to follow up on that, for Dr. Etches, if, these types of parties do occur, do they present a bigger challenge to contact tracing, especially, maybe in the first week or so of school, when people may not know each other at these parties?
So we'll always start with who are the close contacts and identifying the close contacts. And so if people are practicing wearing masks indoors and physically distancing, that limits the risk of transmission. Certainly when people are in classes together, those are class lists we could use to follow up. We do recommend a COVID app if you're not quite, connecting with people, if you're going beyond the folks, the COVID app is useful because sometimes we don't always know if that distance, we thought it was 2 meters, but it sort of shrunk. So that COVID app's at canada.ca, and that will also be useful. If there was ever a really significant event or exposure where we needed to follow up with people and we didn't have everybody's name, we would go through the media. You're a partner for us in getting the word out when we need to reach a broader audience.
Okay, thank you.
Thank you. We will move on next to CTV News Ottawa.
Thank you very much. My question is for Chief Slowly. Chief Slowly, with students arriving in town for the first time this weekend, are you concerned what their perception might be with this video circulating about a traffic stop back in July involving a Black man who says he was stopped with a license plate infractions and the plate was not expired?
We're going to be keeping the questions today for specific to COVID-19 and the post-secondary institutions. Would you have another question, CTV News?
Sure, thank you. My question is for Dr. Etches. What outbreak protocols do you have in place with the universities if there is a case in a university residence or in a apartment building around campus?
So we would follow our usual steps of if we found an outbreak, that would be more than one person with a positive COVID test with a link to another person within the 14-day time period where there's the incubation period. And we would be communicating that as we do with schools or daycares. It's on our website if that occurs, but the process is to do the communication to the close contacts first. And so it's very much case by case who needs to know that they're a close contact so they can take the appropriate steps to stop any further transmission. So that may be communication within a floor if people share space, but in fact, I know that the colleges and universities have really limited the shared space in residence. And so the actual number of close contacts should be very small. And if it's in a larger area or a classroom, then we would go further and explore who else needs to know, whether they're staff or beyond. So it's a very similar protocol to our other outbreak investigations, where we'd also be a resource and advise on any environmental cleaning needed and other steps. Does that answer your question?
Yes, thank you very much.
Next question will be from Global News. Global News, the floor is yours.
Thank you. This will be a question for Dr. Etches. Just wondering if there are any lessons that Ottawa Public Health has learned from outbreaks in childcare centers as it relates to how OPH will be handling the return to school in a few days, or as has already started in a few places.
Absolutely. We've had a number of outbreaks in childcare settings over the summer. There are, I think, one or two happening at the moment. And what we've learned is that, it is important to stay home when you're sick. That's the first thing. So, a message to university and college students: if you're not feeling well, you don't have to go to school or class, I should say. And you're asking about the school environment. We're promoting a screen every day that parents use the screen on our website to make sure that if their children have these symptoms that could be related to COVID, that's checked out. That is really the foundation. That is one of the most important things to stop the virus from being introduced. We've learned from the experience of managing outbreaks that there are a lot of questions of parents. And so, this will be the same in school environments, probably colleges and universities. And there's always a little bit of concern if people aren't hearing directly from public health right away. And so, we're working with the principals, with the school boards to make sure that we have timely communication. What happens is we really mostly need to reach the people who are close contacts. So that's always our priority right away, to let those folks know if their child's been a close contact that the child needs to stay home. And then there's steps, they might not need to be tested right away. I think that's another lesson learned. Sometimes parents rush right out to get their child tested if they've heard there's another child in the class who's been tested positive, but that test won't answer the question of whether your child is carrying the COVID virus. Until a period of time has passed, the test won't necessarily pick it up. So our public health nurses are there to explain that, to guide when is the right time to be tested if you're a close contact. So I think the other experience is that we have been able to see the benefit of cohorts. So when people are in one group and they're separate from another group, we've seen that we don't have to close down a whole operation. We can continue with just ensuring those are isolated who have been in close contact. So this is the way we'll be working with schools. We have outbreak teams. This is going a bit further with the schools than in the childcare setting, where we will have designated cooperation between the superintendent, the principal, our school nurse, facilities, people who can do cleaning. It's actually similar to colleges and universities. We'll have dedicated outbreak teams that cross institutions to make sure we're coordinated and communicating clearly.
Great. And on the university topic, we've seen the University of Ottawa institute on-campus testing. Is that a direction you'd like to see potentially the other post-secondary institutions on the call today implement as well?
I think access to testing is something everyone's interested in. We know we've had many calls across either the City of Ottawa to increase access to testing as much as possible. It is our hospital partners who are running the current assessment centers, and they're planning to expand. I think we're seeing the first mobile option open very shortly. So I think we all need to be promoting access to testing wherever we can. Our primary care partners are also part of this picture. So that is, oh dear, I seem to have lost my screen, but hopefully you can still hear me, and I'll wrap up to say that we're here to support if there are others who want to move ahead.
We can still hear you, Dr. Etches.
Okay, I just can't see you. Thank you.
We will be, les prochaines questions vont venir de Le Droit. Le Droit, c'est à vous. Le Droit. We will be moving on next to the Ottawa Citizen. Ottawa Citizen, the floor is yours.
Hi. My first question is actually for the post-secondary leaders that are on the call. I'm wondering if there's any chance you can just very briefly each outline your plans for the winter semester when it comes to the breakdown, online learning, online courses, and in-person on-campus activity.
Claude here from Algonquin College. I can go first because I recently announced that we would be following the same approach that we are deploying for the fall. So we will teach remotely all theory that can be done in that manner, and only bring on campus our learners for hands-on applied activities where it makes sense to do so.
This is Lise from La Cité, and I will say, repeat what Claude has said. I think we have to plan that it will be the same way to proceed for the winter semester. And I think as we gradually move along, we will adjust to the situation and adapt, but same same way of proceeding will be applied for the winter.
At Carleton, we've also announced that we would be following essentially the same plan as we did for the fall. Although, of course, if circumstances allow, we might be able to progressively bring in more activities to campus.
Again, my three colleagues have stolen my light, so I won't repeat what has just been said.
And a follow-up question.
Yeah, thanks so much. And I also wanted to ask specifically to Jacques Fremont, just I noticed you mentioned earlier that, you expect students to abide by public health both on and off campus. Can you speak to, will students face any kind of university sanctions or university response if they are flagged as failing to abide by the COVID-19 rules? And if this is a plan at any of the other schools, feel free to pipe in as well.
Well, I mean, the call is a moral call, and we will be insistent on that. It is very important that the behavior is proper within campus and outside campus, but of course, we don't have jurisdiction for outside campus activities, so we will have to rely more on the public health and the various authorities you just heard about. But we do insist that there's a responsibility for the future leaders of society, our students, to understand the gravity of the situation and their personal responsibility with regard to that.
Thanks so much.
We will now be hearing from Radio-Canada. C'est à vous la parole.
Bonjour, merci. Boris Pou, Radio-Canada. Ma première question est pour M. Fremont de l'Université d'Ottawa. Vous avez parlé de l'importance de la santé mentale. Donc, j'aimerais savoir comment ça se traduit pour des facultés ou des endroits où c'est peut-être plus critique. Je pense en particulier à la faculté de médecine. On est encore en train de terminer la session de printemps, les stages sont recommencés. Par-dessus tout ça, il y a des examens. C'est de la compréhension de certains étudiants qui ne peuvent pas non plus s'absenter pour cause de maladie. Donc, il y a la COVID-19 en ce moment. J'aimerais savoir, vous n'êtes pas non plus sans savoir qu'une personne s'est enlevée la vie dans l'une de vos cohortes actuelles. Donc, qu'est-ce qui est fait concrètement pour aider ces étudiants-là qui sentent peut-être la pression d'avoir à avancer leur cheminement académique?
Écoutez, on fait tout notre possible. Nous venons de mettre sur pied un bureau pour coordonner toute notre action en santé mentale et il va y avoir de l'action du côté du suivi par, on espère, des moyens électroniques, par davantage de soutien au niveau des thérapeutes qui sont à la disposition des étudiants. Et nous allons graduellement essayer de travailler, d'avoir des gens qui sont spécialisés par rapport à une faculté ou une autre. Vous faites référence à la faculté de médecine. Je peux vous dire qu'il y a 10 facultés sur mon campus et que les niveaux d'anxiété sont distribués de façon relativement égale. C'est sûr que la faculté de médecine, il y a beaucoup plus de présence. C'est une des facultés où il y a le plus de présence. C'est une des facultés où il y a le plus de pression aussi pour les jeunes qui sont dans les cohortes. Mais nous allons continuer de façon résolue à travailler là-dessus. Donc, augmentation du nombre de thérapeutes, particularisation dans certaines facultés de l'aide particulière, et certainement une généralisation des messages. Un des problèmes à l'Université d'Ottawa était que les messages se perdaient, les gens qui étaient en détresse ne savaient pas où s'adresser. Alors, dès les prochains jours, ça va être beaucoup plus clair, les façons de réagir et de se faire soutenir.
Merci beaucoup. J'avais une question aussi pour M. Watson. Monsieur le maire, vous avez dit tout à l'heure en anglais que certains endroits dans le monde ont lâché leur vigilance. Est-ce que vous considérez que c'est le cas aussi à Ottawa? Et est-ce que c'est pire dans les quartiers étudiants? Je pense à Sandy Hill, le Côte-de-Sable.
Bien, certainement, la raison pour cet appel est de convaincre les étudiants qu'il y a une grande possibilité de contacter COVID-19 si vous êtes dans un grand groupe, des amis, des nouveaux amis à une partie de l'Université d'Ottawa, par exemple sur la rue Russell ou Sunnyside pour l'Université de Carleton. Et c'est important pour nous autres de donner le message que ça, ce n'est pas, cette année, ce n'est pas l'année de commencer vos études à l'université avec la possibilité de contacter COVID-19. Alors, c'est une situation sérieuse. On a vu la situation aux États-Unis avec les autres universités et collèges dans le sud de les États-Unis. Il y a vraiment une possibilité de contacter COVID-19 si vous avez une grande fête dans votre maison de 150 ou 200 personnes. Alors, je vous dis merci à tous les 4 présidents des collèges et universités d'être ici avec nous autres aussi, et aussi les 4 présidents des étudiants, des associations étudiantes à Carleton, la Cité, l'Université d'Ottawa et Algonquin, pour votre appui et de continuer de communiquer avec leurs collègues sur le campus et dans le campus, de respecter les lois et respecter les recommandations de santé publique d'Ottawa. Merci.
The next question will be from the Canadian Press. The Canadian Press, the floor is yours.
Thank you. This is for all the post-secondary heads. I'm just curious about, I'm aware of U Ottawa's policy, but if maybe you guys could all just give a brief statement on students returning to residences and dorms. I'm just wondering what the sort of thought process is there in terms of containing the spread of COVID-19, especially in closed or shared living spaces.
Maybe I can start at Carleton first. We've had students in residence throughout the summer, so we've had the chance to develop expertise along the way. It was important for us in March and April when COVID-19 accelerated, not to throw anybody out. And we kept about 400 students that didn't have other options, both nationally and internationally within our residences. And we were able to develop a number of protocols around the single rooms, social distancing, closing public spaces, and obviously adapting the way that we serve our meals to really limit the risk of exposure to COVID. And we're very much continuing along those lines. Our policy will look very similar to the one adopted at the University of Ottawa.
Similarly, for Algonquin College, we had students in residence throughout the summer, and we learned a lot from that. And with the implementation of mandatory masks, now students will wear masks when they're outside of their room proper, and in their room, they'll have their own room as well. So we have a capacity for over 1,000 students, but we'll only have over 400 for the fall. So every student will have their own room, their own compartment, and they will have to wear masks when they're outside of their room. Similarly, public spaces have been closed down or seriously limited to ensure that we respect physical distancing and group size.
This would be the same for these Beaufort-Cité, and I will not repeat what Claude has said, but I will say that this is a feature that was we worked well together, and whatever decisions were taken from with Algonquin, we took them together so that there would be similar functioning for both our residences and our campuses. And we shared with also universities so that the students would not feel different or would have the same circumstances in all of our, whether residences or campuses.
If I just may add, one of the chances we have at the University of Ottawa is that we are dealing with former hotels. So it's one student, one bathroom for floors after floors after floors. So it's much easier to keep the physical distancing in those circumstances. It raises issues as to the future residences we're going to build. What model will we take, and are the former models still relevant in a post-COVID world? It will be an interesting question.
That's all I had. Thanks so much.
Thank you. Our next question, la prochaine question, TVA Gatineau-Ottawa. À vous la parole.
Oui, bonjour. La question est pour peu importe qui voudra répondre en français, mais vous venez d'aborder la question des résidences. On le sait qu'il y a énormément d'étudiants qui vont y être. Il y a beaucoup d'échanges, c'est-à-dire des gens qui se déplacent parfois d'une chambre à l'autre. Comment est-ce que vous faites pour vous assurer justement de pouvoir limiter les dégâts qui peuvent être faits, si vous voulez, là, dans les résidences?
Je peux répondre en partie, mes collègues pourront compléter, mais puisqu'il y aura seulement que 50% des résidents qui seront en résidence à l'automne, ça veut dire qu'il y a beaucoup moins de gens et les étudiants ou les résidents devront porter le masque en tout temps, sauf dans leur chambre. Bon, pour le voyagement entre les chambres, bien sûr, il y aura une certaine, en tout cas pour la cité, une certaine surveillance qui sera faite dans la résidence avec des gens qui vont s'assurer que les règles sont bien suivies. Et il y a peu d'aires communes qui vont être accessibles. Par exemple, il y aura la buanderie qui va demeurer ouverte et où les gens devront porter leur masque. Alors, il y aura certainement un certain contrôle qui sera assuré pour que les étudiants, mais encore, je pense qu'on a confiance aussi que nos étudiants reconnaissent qu'ils ont une responsabilité non seulement envers eux, mais aussi envers les collègues et les autres gens qu'ils pourront voir par la suite, de respecter les consignes sanitaires.
Nous avons des personnes responsables, pas responsables, mais des animateurs sur chaque étage dans nos résidences pour s'assurer de la santé physique, de la santé mentale et du respect des règles. Alors ça, c'était bien avant la crise du COVID, ça a toujours été là. C'est une façon de rassurer les jeunes, de rassurer leurs parents aussi sur ce qui se passe en résidence. Alors, ça va continuer et ça continue. Donc, on continue ces pratiques.
Avez-vous une question de suivi?
Non, merci beaucoup.
Alors, ceci conclut notre point de presse aujourd'hui. This is all the time we have for today. Thank you very much, everyone, for all your time, your patience, and wishing you all an excellent day. Merci beaucoup.
Thank you, partners.
Merci.
Merci.
Merci.